Allergic reaction slash anaphylaxis, 8001. Definition: allergic reaction, a local response to an antigen involving skin, rash, hives, edema, nasal congestion, watery eyes, etc., with normal vital signs. Anaphylaxis, a systemic response to an antigen involving two or more organ systems, or any involvement of the upper and or lower respiratory systems, or any dearrangement of vital signs. Notes: high-risk allergic reaction. Allergic reaction with a history of anaphylaxis or significant exposure with worsening symptoms. High-risk allergic reactions should be monitored closely for deterioration and treated as anaphylaxis for any worsening symptoms. Any involvement of the respiratory system, wheezing, stridor, or oral facial edema will be treated as anaphylaxis. Remember that allergic reactions may deteriorate into anaphylaxis. Reassess often and be prepared to treat for anaphylaxis. Protocol: BLS. Allergic reaction: 1. Assess circulation, airway, breathing, CAB. 2. Remove the sting/injection mechanism. 3. Position of comfort, reduce anxiety. 4. SpO2 with supplemental O2 as necessary to maintain SpO2 greater than or equal to 94%. 5. Suction as needed. 6. Airway adjuncts as needed. Anaphylaxis: 1. Administer epinephrine by autoinjector if needed. Epinephrine autoinjector 0.3 mg IM for patients greater than or equal to 30 kilograms. Do not repeat. Record the time of injection. Epinephrine autoinjector 0.15 mg IM for patients less than or equal to 30 kilograms. Do not repeat. Record the time of injection. Transport and begin therapy simultaneously. Note: EMTs who have received epi autoinjector training pursuant to SCIMSA PD number 2220, EMT scope of practice, or possess a California EMSA epinephrine certification may administer an autoinjector that is not specifically prescribed to the patient. ALS. Allergic reaction: 1. Consider diphenhydramine 50 mg PO IM IV. 2. Consider vascular access. 3. Cardiac monitoring. 4. Reassess. Anaphylaxis: 1. Epinephrine 1 to 1,000, 0.3 mg IM. May repeat in 15 minutes up to 3 doses, max dose 0.9 mg if symptoms persist. 2. Establish large bore vascular access with normal saline. Titrate to systolic BP greater than or equal to 90. 3. Diphenhydramine 50 mg IVIO IM. 4. Cardiac and SpO2 monitoring. 5. Albuterol 5 mg 6 milliliter unit dose, handheld nebulizer for wheezing. Reassess after the first treatment. It may be repeated as needed for respiratory distress. 6. Consider CPAP. 7. If no signs of improvement and the patient is in extremis, stridor, persistent hypotension, etc., epinephrine 0.01 mg per milliliter, 10 micrograms per milliliter, 0.5 to 2 mLs every 2 to 5 minutes, 5 to 20 micrograms, IVIO for stridor and hypotension. Titrate to a minimal systolic BP greater than 90, or a total of 0.5 milligrams is given. Inadequate response to epinephrine, 8. Inadequate response to epinephrine and the patient is on beta blockers. Glucagon 1 mg IVIO given over 1 minute. May give IM if no vascular access or delay is anticipated. That is the end of allergic reaction / anaphylaxis.